Today we will discuss the nervous system. The nervous system highly complex. The nervous system is highly complex and integrated system. Integrated system. Nervous system can be divided into two parts. The peripheral nervous system, that is called the PNS, and the central nervous system, that is called the CNS. Now the peripheral nervous system, it can be divided into two parts. Afterwards we have to discuss remaining things. Efferent, system or division. Second is Afferent system or division. And the efferent system, again it's subclassify into two types. Is a somatic nervous system, or it is also known as voluntary systems. And second class is autonomic nervous system, or involuntary system. And again subclassify the autonomous nervous system can be divided into two types. Is a sympathetic nervous system. Sympathetic nervous system. Now, in the very briefly, the nervous system classified. Now, see what is peripheral nervous system. The peripheral nervous system. Peripheral nervous system, it includes the 12 pair of cranial nerves. It includes cranial nerve and 31 pair of spinal nerves. It is truly distributed in the body It is truly distributed in the body. Okay. The peripheral nervous system, it can be divided into two parts: efferent nervous system and the afferent nervous system. And the efferent nervous system, in the division, the neuron carry the signal away from the brain and spinal cord to the peripheral nervous system, and the second type is the afferent nervous system. Here the neuron bring the information from from the peripheral to the central nervous system. Okay. Then the afferent nervous system, it can be divided into two types: somatic nervous system and the autonomic nervous system. Somatic nervous system, it is called the voluntary system. That is the movement is body is doing as per your will. In the involuntary system, the movement is doing automatically. For example, heart rate, blood flow to the organ, glandular secretions, etc., respiration, control body temperature, visual, etc. In the simple language, in the somatic nervous system, as per will you have to do your work. In the atomic, all activity going automatically. Those should not control in your hands. That is called as the involuntary system or autonomous nervous system. Autonomous nervous system, again, it can be divided into two parts: sympathetic nervous system and the parasympathetic nervous system. In the sympathetic nervous system, it regulate and utilization of the body energy, in the parasympathetic nervous system, it regulate the conversion of the body energy. Okay. Now this is very briefly, I can explain all these things. Already last year in the first years studied, the nervous system anatomy, physiology. Okay. Stop. Now we will discuss the sympathetic nervous system. Sympathetic nervous system is may also called as the sympathomimic drug, adrenergic drug. Now first we can discuss sympathetic nervous system. The sympathetic nervous system that nerve is origin from thoracic and the lumbar region of the spinal cord. That is the preganglionic nerves before the ganglion. Here is the synapse. Thousands of nerve bundle is formed. That is called as a. Here is the synapse, and that is called the ganglion. That ganglion called as the autonomic ganglion. Here is released the autonomic ganglion, release the chemical that is called the neurotransmitter. That neurotransmitter is called as the acetylcholine. And here is that release in the ganglion is called as the ganglion, and the nerve is origin from the ganglion, that is called as the postganglionic nerves, joined to the effector organs. Here release the neurotransmitter, that is adrenaline. That is effector organ. That nerve is called as the ganglionic sympathetic nerve. That preganglionic sympathetic nerve is innervated by that part, that is thoracic and the lumbar region of spinal cord. And then they release the neurotransmitter in the synapse, that is called the ganglion. That's why it's before the ganglion, that is called as the preganglionic sympathetic nerves, and these nerves is called as after the ganglion, that is called the post ganglionic sympathetic nerves. And they release the neurotransmitter. Here is adrenaline, noradrenaline, and to release the effector organ. The effector organ having the receptor alpha, beta receptor, and that neurotransmitter interact with the both receptor, and the alpha receptor again is classified alpha 1, alpha 2 and the alpha 3, and the beta is classified beta 1, beta 2 receptors. This specific receptor located in the different part of the body and drug is interactions. Briefly, its origin from sympathetic nervous system. This part is the preganglionic nerve is innervated by the thoracic and the lumbar region of the spinal cord. Then preganglionic nerve is having the synapse, thousands of nerve bundle form. That synapse is called as the atomic ganglion. They having that ganglion having the nicotinic receptor that release the neurotransmitter in the ganglion, that is called acetylcholine. And then postganglionic nerve is innervated from the ganglion. They release the neurotransmitter adrenaline and the noradrenaline. They produce an effector organ. Effector organ having alpha and beta receptor. Again they subclassify alpha 1 and alpha 2, not alpha 3. Beta 1 is classified. Beta 1 is a cardiac receptor, beta 2 is a bronchial receptor, beta 3 is a liposis produced that affect the sympathetic nervous systems. Now what is sympathetic nervous system? The sympathetic drug or sympathomimetic drug or adrenergic drug are the agent that produce some or all effects of sympathetic nerve stimulation. See, sympathetic drugs, sympathomimetic drugs or adrenergic drugs are all the same. All these are the agents that effect on that whole system. That is a sympathetic drugs effect on that system of all effect of sympathetic nerve, that is preganglionic nerve and the postganglionic nerve. They are stimulation and they affect on alpha and beta, that is called as the sympathetic. They affect on sympathetic drug. Sympathetic drug affect on sympathetic nerve system, all the nerves they can stimulate and they produce the effect. Okay. Before that, nicotinic receptor release the acetylcholine in the ganglion. Nicotinic receptor release the acetylcholine in ganglion. Then the stimulation by postganglionic nerves, they release the noradrenaline and they affect on here is adrenergic receptor. Adrenergic receptor, these are alpha and the beta receptor. Alpha can classify alpha 1, alpha 2, beta can classify 1, 2, 3, beta 1, beta 2 and 3. Now let's see the sympathetic drugs. Now first, most important topic, classification of sympathetic drug. Now the first class, catecholamine. Example, adrenaline, most useful drug always kept in the physician's kit, is also called as adrenaline, is also called as epinephrine. Second, noradrenaline, that is also called as a norepinephrine. Isoadrenaline, the specific drug and the specific receptor in the specific part of the body. Dopamine, dobutamine. The second class, non-catecholamine. Non-catecholamines. Example, ephedrine, epinephrine. Don't make a silly mistakes during the reading. Amphetamine, methamphetamine, phenylephrine, methoxamine, and the third class. Next, selective beta adrenergic stimulants. It can again classify two types: beta 2 agonist and beta 1 agonist. Example of beta 2 agonist is metoprolol, salbutamol, phenobarbital, terbutaline, ritodrine, isoetherine, buterol, and beta 2 agonist. Beta 1 agonist is prenatrol. Now this is the classification of the sympathetic drugs or adrenergic. Is also called as a also adrenergic drug. Drug classification. You may also call as a sympathetic drug classification. Now the next is you can see the catecholamines. The catecholamines is used a drug of structure 3,4-dihydroxy benzene 3,4-dioxybenzene, that is catechol. That is the basic nucleus of the catechol. You may be studied in chemistry part 2, catechol, and joined by ethylamine side change. Sympathetic drug produce the response interaction. Now the sympathetic drugs produce the action on sympathetic receptors, that is adrenergic receptor, that may alpha 1, alpha 2, beta 1, beta 2. The sympathetic drug have affinity of the different receptor for the different drug interact with the different receptors. The adrenergic has the affinity of the adrenergic drug is because of adrenergic adrenaline drug having the affinity all adrenergic receptors. These interact with the both alpha 1, alpha 2, beta 1 and beta 2. Then isopyrenolines drug is have high affinity of beta 1 and the beta 2. Noradrenaline having the high affinity to alpha and beta 1 receptors. Different adrenergic receptors are present at different sites and they produce the response vary on the stimulations. Now you can see the next is the most important part. Now these are the drugs interact with the various receptors. Pharmacology. Pharmacological action. Adrenaline as prototype. First, no effect on cardiovascular system. That first is that vascular system having the effect, it should be the heart. The adrenaline has, see the adrenaline effect, now the adrenaline effect on heart, directly they are stimulatory effect. This produces a stimulatory effect and then it increase the heart rate, increase the contraction and increase the cardiac output. This should be in. Now adrenaline is produces a stimulatory effect on heart. It increases the heart rate, increase the contraction, force of contraction and increase the cardiac output due to stimulation effect on beta 1 receptor, those located in the heart. Okay. Now that is, it may call as adrenaline is may call as positive inotropic effect, means force of contraction and the positive gonotropic effect is called because increase the heart rate. And adrenaline kept in physician kit. Adrenaline always kept in physician kit. The reasons is asked. That is the first reason. They produce the which action? Stimulatory action. That is the first reason. Why they kept in physician kit? Because of the stimulatory effect. Second, most important action, blood vessel. The adrenaline act on the blood vessels. It produces both vasoconstriction and vasodilation effect occur on the blood vessel. Is produced on the blood vessel by adrenaline drug, but it totally dose dependent. Its action is produced is a dose dependent. Now see the first, blood vessels. Where is present? Now the blood vessels is present, is act on the constricted actions. Is present skin, mucous membrane, and visceral organ like kidney. They are constrict the blood vessel due to action on alpha receptor. Due to alpha receptor means alpha 1 receptor, blood vessel should be constricted. Which part? Skin, mucous membrane, visceral organ like kidney. Blood vessels are constricted due to action on alpha 1 receptors. Dilation is prominent in the skeletal muscle. The dilation action in part of body, skeletal, liver, and coronary artery. Now, isoperinally is a pure beta agonist. Is affinity having the beta receptor only, means beta 1 and beta 2 receptors, and dilate. This should be directly dilate the blood vessel, dilate the blood vessels because of beta agonist. Both alpha and beta 2 receptor are present in the blood vessels. Alpha 1 and the beta should be present in the blood vessel of skeletal muscle. Skeletal muscles. The effect of adrenaline on blood vessel is totally adrenaline effect on blood vessels totally dose dependent. Adrenaline large dose cause constriction action due to alpha receptor, and the low dose of adrenaline cause dilation action. Low dose of action is dilation action on the blood vessels due to action of beta 2 receptors. It's important. That's action of alpha and also beta. Adrenaline is totally dose dependent. The large dose cause of adrenaline constriction, and they cause blood vessels. They are constricted because of alpha receptor action. Low dose of adrenaline is dilate the blood vessel because of beta 2 receptor. That's why here initially adrenaline is act on the vasoconstriction, vasodilation, both effect is totally dose dependent. You understand? Okay. The next last part, blood vessel, blood pressure. Adrenaline given intravenously. Adrenaline given intravenously rise in the blood pressure, rise the blood pressure proportionally to the dose. When adrenaline is over, blood pressure returns to the normal. When the adrenaline, see the intravenously is given, rise the blood pressures proportionally to the dose. When the adrenaline is over, no effect present in the blood, it should be the over. Then blood pressure, adrenaline is over in the blood pressure returns in the normal. Blood pressure, okay, stop. The next step, stop.